Yeah, thank you so much. It's really, really lovely to be here. So my name's Donna Ramsay, I'm an occupational therapist and I'm currently a Darzi Fellow with the Applied Research Collaboration in Surrey Sussex. For those of you who aren't familiar with the Applied Research Collaboration, its acronym is AHP, and there are like 15 of them in the country. They're funded predominantly by the NIHR. And they look at population-based need research, so they're really about getting research into communities, responding to the needs of the community. So one of the things, for example, is dementia, because we've got the highest rate in Surrey Sussex of dementia in the country. So it's those sorts of trying to be responsive to that. And the ARC sponsored a Darzi Fellow, which is like a training programme and a project, and it's a really great training programme. If you've ever seen an opportunity to do one, they're really great. And you get a chance to do a fellowship project within an organisation. And the one that I've been looking at is trying to look at improving and increasing the opportunities for health and social care professionals to be involved in research. As there are members of my former team, I'm very passionate about research, which is why I was attracted to the role and its potential. So I'm just going to run through a little bit about that today, and also what I've been doing linked to my role in the ARC. So I'm going to start with a question for yourselves, and then I'll be touching on the research benefits and having a little think about the sort of current research imperatives and the barriers that we all face before I give you a little bit of an introduction, hopefully, fingers crossed, to a quick guide to support clinicians who are interested in pursuing research at any level, so just to get engaged in change really. So this is your question for you guys, so it's just to have a quick chat about in twos. I'm not going to ask for verbal feedback, but just maybe a show of hands to certain questions. Have a quick chat about what are the challenges for you currently in your roles, and what are the biggest challenges for you really within your roles in health and social care, wherever you're working. So just come to have a little bit of a chat. Forward to if you're struggling. Okay. So you may end up talking about your weekend. You're really fine. And you may just be thinking about your challenges, which nobody was talking about it. But if you can, I'm going to run through a few thoughts of what these might be, if you can hand up as many or as little as you like. But how many of you spoke about the challenges you're facing in terms of the complexity of work that we're facing clinically at the moment, and also the pressures of waiting lists and the sheer demand of work? And how many of you have been talking about the challenges of economic pressures, so the ability to have enough adequate staffing to address the issues around sufficient services, robust infrastructure both in your service and outside your service to support you? And what about, did any of you talk about the community challenges, so things within your community, if it's perhaps health inequalities or any challenges around that? It's just one step beyond. And what about workforce challenges, so staff morale, two hats in the air staff morale challenges sort of in this middle COVID world, and not quite post-COVID, are we? And also recruitment and retention being an issue. I guess from my perspective, we won't be surprised at all, but I really strongly, all the research shows that for me, research is like, and I kind of, in that term, I include research, innovation, quality improvement, audit, all sort of sits under the same banner of improving and making changes for the people we support and for ourselves. Research answers every question that we have. It has been shown to provide incredible benefits to all of these things, and for me it's like the best kept secret really, the fact that we have this thing that only benefits every aspect of our system, and yet for some reason, and for numerous reasons, I'm sure we can, you've got ideas, and I know I've heard plenty of people talk about the barriers we face in terms of engaging with it. But for example, in terms of health benefits, we know that where we apply research, there is better health outcomes for the people we support, and there's better survival rates for the people we support. We know economically, for every pound, for example, that is invested in Cancer Research UK, £1.40 comes back into the economy. And so that has a kind of very significant financial benefit, and that's on a big level, but that really does filter down into smaller projects as well. We also know it has incredible impact on communities where it is locally created and locally delivered. There can be real transformational changes towards improvements in those communities. And finally, we know it has massive impact on staff in terms of improving morale, improving retention, and clinical expertise. And we can talk a bit about why perhaps it's a challenge to then get that into the system in the way that it is. But for me, within our current context of the cost of living crisis, the additional pressures that all our services face post the COVID time, there is a kind of question for me around how do we respond to that, because we can't just keep trying to do more of the same faster, and actually if we do want to try and do something which we know will have a good impact, then research is a really good answer to some of those challenges. The barriers, which I'm sure that if I asked you right now to consider those, in fact I will, I'll ask you to kind of go back into the person you're with and just have a brief chat about some of the barriers to why you might struggle to engage in any form of research agenda, whether it's quality improvement or otherwise. So let's do that for a couple of minutes and then come back. So again, thank you for a show of hands in terms of what sort of things came up for you. How many people mentioned time? That is the most common reason communicated for challenges to getting towards research. And I think that sort of for me sits around numerous issues of because of course we do make time for things that need to be prioritised, don't we? And so actually it's a lot about what's been pushed down to us in terms of what needs to be prioritised, and even that not fitting with a research agenda. And so you're kind of busy doing that. How many people talked about things like infrastructure aspects, or not being part of our job descriptions or anything like that? Did that come up at all? Support from your managers? Yeah. It's I think what's been really interesting, it's been a really great privilege for me coming into the Applied Research Collaborative. I've had a lovely time going and talking to lots of people, both within organisations, research-focused organisations like Clinical Research Network, Research Design Service, Applied Research Collaborative, and there's all of this infrastructure out there to support research in the NHS. It's seen when you look at as like the most critical part when you look at those organisations who are saying this is what we need from a government perspective, this is what we need to change lives, it's imperative. But actually they sit outside of our organisations, don't they? And then they're trying to kind of encourage us to engage from the outside, and we sort of work on different timings. That's a really crucial one that we work a lot. And a lot of people, I recognise there's quite a lot of inequality. So for example, while it's not perfect in medicine and psychology, they have job descriptions and a career pathway which is inclusive of research in the way that allied health professionals, nurses and midwives don't have that kind of infrastructure in the same way. There's a lot of people aiming to try and address those things, but that's quite a significant part of why it might be harder for us to engage with it. And our systems often don't talk to each other, they operate quite separately. So these things hinder us from being able to engage in those kind of ways. As part of the main part of the discussion that I've found, especially talking to people who were interested in wanting to get engaged in research, but their fingers have been a bit burnt really by not being encouraged or supported fully, that's where they were working, etc. There was also a sense that people didn't know what was out there, what support was available, the training opportunities, the access to research active people, the stories about people who have managed to do it and managed to kind of make breakthroughs. And so as part of that, within the Applied Research Collaborative, we're in the process of, and it's in draft form, devising a quick guide. I'm hoping I can share it with you now. It's not a way to duplicate what's out there, because there's tons of amazing resources out there, because those of you who are committed to wanting to support anyone working in health and social care to engage in research. It's about kind of finding one place that can point you in the right direction. That's really the role of it. So this is the draft currently of the quick guide, and it really is, although it's sort of set up like, I won't be going through too much detail, so don't worry, but although it's set up as within Prezi, like a presentation, you just literally access it around the question that you have. So it's not to, don't go through another presentation, otherwise you'll be seasick and equally really bored within 2 minutes. So it's kind of asking, like, thinking about where you are on the journey and then clicking into each link to answer a question. So I'm not trying this before because I'm not being face to face with anyone. Does anyone have a question about research in terms of where they are? And I think, like I say, this is for everybody. Research is for everyone. It's not an elitist thing. You could be literally brand new, out of uni and just be interested to know what your research base is for the area you're in, and it will sort of support you to try and find out that information. Or you might be somebody who really wants to be a career researcher and develop and carry on through and do masters and PhDs. But it is about wherever you are, and it's important to sort of say that that knowledge is everyone's knowledge. It's not just for some privileged few. It's really about getting it out there, really. Does anyone have a question that we can try and then see if I can answer with a quick guide, and equally I'll find out then what needs changing if I can't. Thanks, Amanda. It's like I primed you.
Surely not.
That'll be your question.
Well, I was thinking, is there anything else, are there any courses that are funded that I might be able to take my IPAC? So I've got one module and masters. Interesting with masters, I'm not particularly interested in PhD. What might be available?
That's a very good question. Sorry, I should have given you mics available. I'll quickly repeat it. So, Amanda asked, is there any potential funding, because she's got her ICAP, which is the first module of her masters, and what could be the options after that. So that links into, I don't think you'd naturally go here, but I have an idea to get how to get started. And it talks about, I've got an idea of where you might go, how to get started, and I've not got much time, so it takes you into things. But this bit is, takes you through short courses, masters towards PhD, and in each one it will take you into hyperlinks too, because as I said, I'm not trying to recreate what's already there, it's just putting it in a place that we can see in one place. So they're one option, and then another aspect, you can also look for professional specific advice, and this is where we're also including my story, so you'll see me here. Because I received a Royal College of OT career research grant, I just sort of included that in terms of how helpful that was for my journey. So it's just encouraging people there are other ways to get money. And we're going to be using my stories throughout. At the moment I'm just collating them, which is why they're not all in place. But there's some amazing, amazing stories that are really inspiring from all professions in terms of just taking small steps towards starting and just being like sitting with it physically with a question and thinking, what do I do with that? And then taking it through into pursuing a further option. Does anyone else have another thing that they might be interested in finding out about? I need you to plant more people in the audience. Any other questions, or should I just show you a couple of the boxes? I think you kind of get the gist. I'm not going to run you through all of them, but you get the gist. There's, like I mentioned, there's loads of networks, and again, like what's the difference between the Clinical Research Network, the RDS, the ARC, and all of these then have hyperlinks through to get connected with what those things offer in Kent, Surrey and Sussex. This stuff, as I say, I've got a real passion for democratising research. This should be available to everybody, not just starting out in research, but who wants to develop as a researcher. And that actually the smallest idea can start from the smallest seed in any organisation. A problem, a challenge with practice, something that a parent or carer says, or the patient says, and you're like, I could address this. We all know them, we all come across it in our practice, and it's just starting that journey and encouraging you that there is support out there to help you. So I'm going to stop there and just ask if there are any questions. Sure.
Yeah. My question is that I think a lot of people are scared by research. They find it quite academic, or I don't feel like I have the skills to do that. How can we encourage people to say that it isn't scary, it is, like I say, it is open to everybody, and the support there, because I still think there's this kind of attachment to that, academia, people going to research. Is there more opportunity to do more collaborative work or mentoring and coaching around research?
Yeah, that's a really good point, Shirley. So Shirley just asked how can we kind of get over this sort of barrier of thinking that research isn't for us and that it's somehow for other people. and demystify it a bit. I think it is actually about challenging that system a bit. When I can guarantee you, if you approached your research and development team within your organisation, if you're in a charity, somebody will be thinking about research. If you approach them, they will be delighted and they will be hugely supportive. And I think historically there has been a bit of a sense that, oh, it's relevant for these people and not for these people. And there has been a bit of people have been put off because they start and then they get pushed, their idea gets kind of like narrowed down by somebody saying, you haven't thought about this, you haven't thought about that. But there is some really fantastic stuff in the Applied Research Collaborative. There's free mentoring, so you can sign up and get free mentoring. I'll make sure that we circulate the link to the Academy website. There's free training. There is somebody to talk to and literally say, I'm interested in doing a bit more study, and you can link up and talk to somebody in IHR and get some information about where to go. So there is an infrastructure there that's really supportive, and it's not about being, I can't stress enough, but I can see how it has been sort of seen as something over here. I'm very passionate about the fact that knowledge needs to be owned by the patients and the people that create it. It's not owned by academics. It might be published somewhere, but in terms of making impact and change, it's owned by you as healthcare professionals to sort of say, this is something that can work for the people I support, and this is a change that's really needed for them. So it's really important that we sort of start communicating that and we overcome the barriers in that way. Amanda?
I just want to say that we've been doing some participatory.
Do you want the microphone?
We've been doing some participatory action research in the team, in the Learning Disability OT team, and that's meant that about 10 of us actually have been involved in getting involved in actually doing some research, and I think that's a really, hopefully, a good way of demonstrating that it's something that we can all do. That has been helped by having a link with Dr. David Haynes from Brighton University, who has sort of guided us through and worked on the research with us. But I think that's a really good way of infusing people and making people understand that it is actually something that we can all do, while still keeping enough academic rigour for it to be a valuable piece of research that's transferable to other professions and has got that sort of level of respect as being good quality, hopefully. Fingers crossed, that's the plan.
Thanks, Amanda. So I just sort of say, please don't feel you have to be thinking about doing further studies or becoming a researcher or even growing your own. Just start by thinking, where is the research for my client base? Have a look at that. What's niggling me about what I'm doing? You could start with a quality improvement project. You could start anywhere. You can start by just finding a journal and having a bit of a club to discuss it. It's about just recognising that this is the bedrock of our practice, and it's not an add-on that we just sort of attach into our work. We want our work to be meaningful and make change for the people we support. Thank you. I'm going to stop on my soapbox.